Welcome back, brave hearts, to the Detox WOLFE Non-Surgical show with Sage and Jason. I'm Sage.
And I'm Jason.
And here we are your host and guides to creating the perfect strategy for the life that you have been promised and for what you truly desire. Today we're going to be going over, like I touched on last week, we're going to be going over what one-shot therapy is. So at home that you can kind of go into your own little aches and pains, stiff little joints like in my ankles, everything I can kind of reach that is a smaller joint in general. We're going to be able to go in and just pull the crystallization, the displaced calcium, and the scar tissue apart that's kind of binded those tendons, ligaments, and joints together. And so we're going to be going over one-shot therapy. If you have any questions, please chime in so we can kind of answer those as we go along. Other than that, welcome everybody, and thank you for joining us.
All right, so let's get started with the shot glass therapy. All right, so we've got the shot glass here. You can use an essential oil bottle, like a 10 ml bottle works great, or a 30 ml bottle.
Yeah, it literally just like you want something with a solid curve on the end. Like if it's a shot glass, you don't want it to have too much of a lip either. Like if it's like more of a sharp kind of or like not serrated, but like a thin lip of an edge, that's going to give you a blood rash a little quicker. So we want something that has a nice kind of curvature to the bottom, but not too curvy where it's circular, but like around essential oil bottles and some shot glasses, they have a nice rounded edge that we can kind of work in and work around with.
Oftentimes you can even use a gouache stone. They have a nice curvature, especially for the jawline areas like such. Really depends on where you're working too. Like if I'm working on a finger, I want something that's a bit pointier, but it really depends.
And for some people, what is a gouache stone?
Gouache stone, you can get, they're like jade stones or rose quartz stones, and they're great for the lymphatic system, but also opening up scar tissue, crystallization, and even bringing down some of that displaced calcium.
Okay, so I'll grab a little essential oil bottle if you want to take the shot glass. With these essential oil bottles, they have a little ripple on the bottom, so I would just monitor that, because some people, when they go home and they want to start doing shot glass therapy, they kind of get out of their head while they're working it, and they won't be paying attention to the area that they're focusing on. And then they often end up getting like a blood rash or even breaking skin completely. So that's something you do want to monitor. You always want to be focused in, like even if I am just watching TV and doing it, I'm not going gung-ho and not paying attention and scrubbing back and forth. That's the thing we really want to not do, because the consistency of the scrubbing is what's going to take the skin off. There is always a little method to the madness. And so with the shot glass and the essential oil bottles, you can, with certain techniques, you'll be able to kind of work in and around the joints, the tendons and the ligaments, to kind of free up those general areas that you have kind of isolated yourself.
Basically, all you really need is shot glass or an essential oil bottle, and then I do recommend using an oil of some sort. Yeah. I had a client come in today, and I was working on her ankle, and I saw she had a little blood rash there, and I was like, what happened here? And she said she was doing the one-shot therapy, and she just got carried away, wasn't using any oil. So you're going to want to focus, breathe, make sure you are paying attention. You're not spending too much time in that area. You want to be moving around and taking your time with it.
I'm just going to read that.
Hello, Jason. Love the hairstyle. Thank you so much, Adele. It's great to hear from you. Hope you're doing well.
Okay. Not too sure what that's saying. Let's go to just this question briefly before we hop in. Hello, you two. I had a hip replacement a few years back. My hip is only getting worse. I'm debating having another operation on my hip. Are there any other alternatives? Yes, there totally is. I really recommend going into our do-it-yourself guide in our Detox library. For hip replacements in general, especially if you already had the replacement, it's a foreign object in the body. So think of like when you have a sliver in your finger, like it's irritated. Like when I kind of brush it over things, like it feels annoyed. So in general, when you have a whole artificial joint in the area, your body thinks it's like, whoa, large foreign object. I don't know, like, and it can't push it out because a lot of times it's implanted, but sometimes like even with certain surgeries and stuff, we will have clients come in that are having their screws and their bolts start to come to the surface of the skin. So sometimes the body doesn't want it in there completely and will reject it. But in general, So let's go back to it. If you have a foreign object in the body, it's totally invasive. The body doesn't know how to attack it in any other way than putting displaced calcium, scar tissue to buffer down the inflammation in the general area. If you're not super healthy, you're going to be losing your bone density to buffer down the inflammation in the general area. So you're going to really want to look into the do-it-yourself guide on our DockADetoxLibrary.com and go over clapping. And you're going to want to get a clapper and really clap the crap out of that hip. If there's anybody in your general area, I'm not too sure where you're from, maybe you could get some non-surgical on the area, some constant stimulation. Even like massages are going to be good for the muscle tissue integrity in the area. So like there's nothing bad about going to like your chiropractor if you have a comfortable relationship with them. Like getting an adjustment is fine. Getting an adjustment weekly is not so great because it's constantly breaking the ice to get you back into position. With massages, it's never going to fix the problem for yourself completely because they're not going to that depth. But to stimulate the muscle tissue to kind of rejuvenate and actually help the connective tissue in the general area, that stuff is amazing for.
And we want to get down to the root. Like originally, why did you have the hip replacement in the first place?
Yeah.
Your hip sits right beside the pelvic bowl. My apologies. So if you have an inflammatory diet, your bowels aren't moving and you're creating a lot of inflammation and acidity in the gut, where is it going to be pulling the calcium from to buffer down all the acidity? Your pelvic bowl and then your hips as well. So we got to go back to that. How is your diet? How are those bowels moving? Are you staying hydrated? We got to bring down that fire because yes, you may have had the surgery, but you actually getting to the root cause of it. So that's something we're going to have to put into perspective as well. So if you haven't yet, you're really going to want to get a perfect day consultation so we can give you those tips and the strategies that you need to really turn this around. Because you can go in there and do another hip replacement, but you're only creating more damage and you're not getting to the root. And that's what we need to get to, is the root.
That's pretty much where it's at. And like over time, yeah, hip replacements can start to deteriorate if they're not really treated well. But like if I'm doing light stretching, even if I had a hip replacement, I'm going to do light stretching on that hip every day. I'm going to do light patting and clapping all around the general area. I'm going to do Epsom salt scrubs with nice essential oils to stimulate more life and healing to that area. Regenerate the tissue, bring life back into the body, have a nice fresh and raw light diet. You're going to buffer down the inflammation that's being put on your body itself and making you feel like you need a second replacement. Let's hop back in to a little bit of the shot glass therapy.
Awesome. Let's do it.
I'm going to focus on my ankle. That's why I'm not wearing socks right now for you guys. I'm going to bring this up a bit because even if I just was feeling a tweak in one section of my ankle, like right on the inside of my medial side of my ankle bone, I just feel like it's kind of limited. It doesn't feel like I have the mobility I want on the other side and with the range of motion I have on my other ankle. I still want to cover the whole general area. So I'm not just going to be working that one side. I want to be working the top, the right side, and the bottom. So this is a pretty small, like, and if you have smaller hands, a 10 mil is going to be great. If you're a larger man and you have large hands, you're going to want to use a 30 mil to 100 mil bottle or a larger shot glass. So you're going to take some oil and apply it on the area because I don't want to go too vigorously at the beginning too, especially the first couple times. Go in with love. Try to take it apart like with love, with being respectful to the body. Not everything needs to change immediately. When we dive head first, a lot of the times the splash is a little bit too overbearing that I kind of want to get out of the cold. But if we kind of dip our toes in, let my legs sit in the water for a bit, I'll acclimate. I'll become more comfortable with the situation I'm in. And then it's like, then I can try to find where I need to go in what direction and what is next. So as I go to work, what I like to really state, guys, is do not scrub. Don't scrub with the bottle. That'll remove the skin. So that's just placing like the bottle or the shot glass on the general area, and I'm scrubbing back and forth. That's going to be pretty damaging, and you're going to notice you're going to be shedding skin pretty quick because it's doing more of a brushing motion, and that's not what we want. So either I want to be pushing or pulling. And I also do use my opposing hand to kind of guide the area that I'm working in, hold around the bottle. So just so I'm not all over the place, just kind of rubbing my ankle. Just say I feel like I was telling you, on the medial side of my ankle, I'll put it up here just to make sure you guys can see pretty well. And so on the medial side of my ankle, all around here, I'm going to want to work around the actual ankle bone itself, all the way around the bone, back into the Achilles tendon. And this is kind of what we call the horseshoe, because if I start from the talus area right at the front, and I come, that's the front of the side of the ankle bone, and I come all the way around to the back side of the Achilles tendon, it's just like a U, a horseshoe shape all around the side of the ankle. So, like I was saying, I don't want to see scrubbing back and forth, back and forth. I want you doing small motions too. I don't want long strokes. If you can do anywhere from a 1/4 inch to a 1/2 inch movement, that's kind of where we want to hover around at. And I'm going to apply a little bit of oil. My kind of guide hand is hanging out right here, and I'm going to either be pushing or pulling towards me, depending on where you're at. But in general, while I'm working the ankle, I'm wanting to work all around it, pushing one direction, and then I want to work the exact same all the way around the ankle, pulling one direction. Because everything, the words are covering up what Sage is demonstrating. Can those be turned off? So they're saying words that are popping up are kind of covering what I'm demonstrating. Is that possible to be turned off or not right now? Because I will be moving to my wrist and my face just because I can show you more so as I'm demonstrating. But hopefully they can maybe do something about that kind of quick. Perfect?
Yeah. Let us know if that's better or we need to adjust it some more. Thanks, Julie.
Okay, so I either am going to be pushing one direction, working all around the ankle bone, or and then I'm going to be working that exact direction, but I'm pulling towards me. As I was saying, scar tissue is kind of like
a 2x4 where you pull one way it's smooth and then you pull the other way it's rough.
Yeah, and so there's always going to be a crack in the knot. There's always going to be a way to stimulate to kind of get in to alleviate the tension and the crystallization built up around the general area. But so if I have a knot or I have like a little crystal that's really tough or a piece of displaced calcium, because a lot of times in the ankles you'll get a lot of calcium buildup because circulation has a hard time getting away from the feet. So if I have a piece of displaced calcium, or you're working on a bunion per se, I want to focusing on my bunion. I would use a little bit of DMSO gel a couple nights before to get it softened, stimulated. When I go to do it, that bunion is so hard. I don't know exactly, because a lot of times you'll feel like you're just jumping over it. But generally, you're going to find a crack in it. So we play every direction possible, but kind of always pulling or pushing back in one direction, never scrubbing.
And that's why we say you want to focus, because you want to keep playing those angles.
Yeah, because I could just sit here watching a movie, and if I'm not paying attention, I'm just going back and forth, kind of causing almost more irritation than doing benefit. So I want you just kind of like, I'm going to spend 10 to 15 minutes working on my bunion tonight. And so I would have a bunion per se right here. It's a little bit softer because I've been sleeping with a Band-Aid and that DMSO gel on it. I take the actual shot glass or the essential oil bottle. I'm isolating with my guide hand, and I'm pulling in a small singular motion where I'm working everything in around that bunion. So I'm pulling towards me. My hand is motioning towards me. And I'm kind of scooping and scraping against that bone. So working all generally around it. And I'm only pulling technically towards me and little bits of angles right now. I'm pulling on kind of 45-degree angles with my hand pivoting like this. But I'm still only pulling towards my direction. Working around the bunion. Really softening up that bunion.
And it's a consistent pressure as he's coming with his stroke. It's not like he's digging or he's jerking at the end.
At the beginning though, guys, you're going to be like, oh, that hurts. And you're going to know that like you're not going to push yourself past pain. Like we don't want to go like to that degree. We want to feel some irritation. You're going to feel a little like popping and snapping underneath the actual shot glass and bottle. And that's going to be, you're kind of working against that calcification. You're pulling apart that little bit of crystallization that's built up on top of it. So I'm just pulling everything towards me and around, and I'm just focusing around that bunion in general. Then I would just switch the angle of the actual shot glass or essential oil bottle to more so directly down, so I have the ledge down, because I always want that smoother side working on me, because if I'm not, I could be really irritating the skin. So I'm going to kind of isolate once again with my guide hand, because it kind of keeps me in control. If I'm not, I just kind of feel like I'm not as controlled with my guide hand there. So my guide hand comes in, I place the essential oil bottle or shot glass, and now I'm kind of grinding up against it and scooping up, pushing up, working all around, because I want you playing all those angles, but now I'm pushing everything up. And as you can see from my eyebrows wincing, like I'm not working it, like I feel it. I don't really have too much of a bunion going on here, but I've damaged my feet. I used to be a professional gymnast. I played enough rugby where my joints do hurt too, so there's no negative effects by doing this. You're not going to just be breaking the bones in your feet, because you're going to what you can handle. You're actually going to alleviating those tendons and ligaments from the crystallization that has bound them. You're bringing more lymph flow in so you can get healthier blood to the area so the tissue can rejuvenate. So really just kind of, that's what I would do for more so a bunion. If you have any other questions on that, shoot us some questions. I'm going to come up to like my talus area. So if I was working on the flat top of my foot, coming down through my metatarsals, I'm going to work from my talus through the metatarsals. I'm going to start with pushing, and then I'll go to pulling. So my guide hand kind of comes in and it sits right here, and I would have a little bit of oil to help me glide along. And I'm working in to the ankle. I'm actually pushing in and kind of scooping out, pushing in, scooping out. And my motion is only about 1/4 to 1/2 inch at a time. I don't want large strokes, because then that's going to just kind of irritate the skin as well. So I'm really just kind of focusing in. I'm going to isolate with my guide hand a little bit, and I'm going to work my way down over the top of the foot, through the metatarsals. And by working the tops of the feet, you're actually helping drain the lymph channels, so that's really beneficial. Fallen arches. So I'm just going to go into that right after I do the top. So just say, per se, I worked my way all the way down, and it would take me about, in all honesty, 2 to 3 minutes to work my way down and back up, just one section of a metatarsal, and then going into each individual one, depending on how much I want to open up that hole, but in general. So after I pushed with the shot glass, working my way, scooping, push down and scoop, push down and scoop, you're going to feel little bits of popping. Yeah, of course, I'm coming over tendons and ligaments, and those are popping over the bones of my foot. But actually, when you're kind of cleaning out the sections, you're going to feel it's like a different kind of popping, like little microscopic like pieces of sand kind of crunching. And you're going to be like, well, that's not a tendon. That's crystallization built up around the area. And some people can, like, as they work, they'll have like a mass somewhere that they're kind of focusing on. And then they'll be like, there's multiple more pieces hanging out around the general area. And I'm like, it's because you took that continent and you turned it into 1,000 islands. And now we're going to have to go in and focus on those 1,000 islands. Martin's neuroma. So we're going to go into fallen arches first. So with a fallen arch, I am going to take that essential oil bottle. I'm kind of doing a 180 with my foot, so it's just sitting on my lap like so. I would take that essential oil bottle or shot glass, and you're digging into the bottom. I'll take the shot glass so you guys can see what that looks like. So these shot glass have a pretty nice rounded lip, and they have a nice rounded bottom. So you kind of have the best of both worlds. I'm going to apply some oil, and I'm going to work. You can do the whole bottom of the foot, but the thing is, it's going to be getting in weird positions for you, so you're just going to have to kind of work your way around, kind of doing it how you'd like. But then to get into my arch, I would just kind of have my foot sit on my lap like so. If not, maybe if you have a partner or a friend, you can lie down, and then they can get the shot glass in there for you. There is like, I used to have one. They're like these nice wooden rollers for feet, and they have like lumps and stuff on that as well. I would have one of those in my house, and I would be doing it like if I sat down at a desk for work, I would be doing it all day while I was sitting at the desk for work. Or if I just like, I only have like like I'm at work and I work outside and I'm too busy, but I'm there in the morning, 3 to 5 minutes in the morning, really pushing vigorously and rolling that over your foot, kind of stimulating as much as you can, because some of that muscle tissue is so bound that it's just infused with scar tissue now that it just feels so tight. So I'd really get in there to soften it up in that general sense. And then so with the shot glass that I'm going to be using, I'm taking that ledge, placing my guide hand, and I would be digging into the bottom of my foot. Only going to what you can handle at the beginning. If it's crazy sensitive, you know you're a little hypertoxic because the tissue is very hypersensitive. So the toxicity levels are a little high in the body. Maybe we want to kind of go into more of a perfect day diet or do like our daily cleansing tea to do some detoxification protocols to get the body not so sensitive. So if we're very sensitive to the touch, that just shows our tissue integrity is not the best, guys.
And if you're sensitive like so, I would start clapping to really stimulate that area.
Clap.
Get some more circulation in there.
And that's the thing, guys. Like, we come on and we do these shows and we're going to be giving you tips and tricks and stuff all the time. Go to our library. Go to our library and just look at all the different types of videos you can see on there, because there's going to be so many different things that you can learn that are going to help you advance, from the belly button therapy to the scrubs to the clapping to the rebounding to the foam rolling. We have tons of stuff on there for you to learn how to heal yourself. And that's really all we're trying to get you to do, is just for people to wake up and know that we don't have to always give in. I would love to go to the hospital when I have stitches, because I don't want to stitch myself up. That doesn't make sense, and that would freak me out. But like, if I'm noticing I'm coming down with a flu, or like I'm getting some aches and pains, I want to be able to address that myself. It's kind of the way it's been for all of history. Yeah, there was like crazy shaman doctors and certain things way back when, and you would go to the healer when the person wasn't able to move themselves. They needed to go. But other than that, it would be crush up some herbs, throw it on that wound, and get to it, because the body wants to heal.
We should all be our own doctors.
Yeah.
That's what was taking away from us. That's why we have this library, to give you these tips and tools that you can take home and that you should learn, because oftentimes you really don't have to go to the hospital. There's easy remedies that you can do, like if you're having a flu, doing a coffee enema to bring down that fever. Tips and tricks like this.
And we're technically only here to give you so much. We like want you to have that like internal motivation that, you know what, the library isn't even enough for me. I want to come down and get trained. I want to do this because I want to do it as a practice, or I want to do it because I just want to be healthy overall myself, or I want to get trained for like my friends and family so I can show them that there is a better way than just what everybody else does. So, getting into that arch, I'm digging in one direction. So right now I will be pushing and then I'm going to pull. And while I'm pushing, I'm playing little bits of angles. Like my hand is pivoting a little bit to either side. I'm going to either side as I'm kind of scooping down, because I don't want it, it's not just straight forward and back. I want to play, all those angles. So I'm pushing deep down and digging into the bottom of my foot. And that stimulation, in all honesty, it feels really great down there. The bottoms of the feet take so much damage. You're on them all the time. So it really does feel pretty great. So I'm just digging throughout the bottom of my foot. After I feel like I was thorough with the push, I'm going to do the pull, and I'm going to be pulling everything towards me now, playing little bits of angles, pivoting with my wrist. So kind of coming through that arch, and I'm digging down and coming in deep, and I'm pulling through. Pull and pull, pull towards you, play little bits of angles, pulling towards me, playing little bits of angles. Not large strokes, like if I was working along the spine of the foot right now. This is kind of how it needs to look. I'm getting in deep, and I'm feeling little bits of crunching on the bottom of my foot. And in all honesty, the itchiness my foot is getting right now, and that just means you get really itchy in the area, I'm bringing it back to life. There's circulation coming to that area. Maybe there's some detoxification. There's like toxins coming out of my actual pores at that time. So like, it depends. Like, start clapping your body. Clap your lymph system really hard. So like under your armpits, inside of the arms, backside of the knees, the groin, under the neck, and you're gonna see yourself perspire like twice as much as normal because your body's like, whoa, overload of stimulation, flush out. But just remember, when you're sweating a lot and you're trying to get your lymph going, really, really hydrate. Please, really, really hydrate. So, I think that kind of covers the ankle in general. I'm going to head on up the body a bit and say knees are going to be a little bit of a tough one because they're such large joints. I would want to get my elbow in there and take that apart myself, or if my knee's kind of irritated, I will do the WOLFE Non-Surgical on my own knees. But like if you're feeling like a little bit at the patella tendon down to where it connects to the tibia and fibia, or you're feeling a little bit just like on the side of your knee or near the quadricep tendon, it's not like a general knee inflammation kind of problem. You can focus and do the exact same thing working in and around the joint. So I'm pulling everything into the joint and I'm pulling everything away from the joint as I work my way down and around, kind of cleaning and clearing, pulling everything into my patella and away from my patella. And once again, you're gonna, but like if I have general knee pain and it's like, oh, my knee's achy all the time, kind of pops out, like a shot glass would get you there maybe after like 7-8 hours of doing it, not all in one go, but I mean like that's gonna take you like 6 months of just like slowly working around your knee with a shot glass. It would be good to get a non-surgical treatment in on the area. Shot glass is really going to be beneficial for mostly feet, face, fingers, wrist, hand. You can get into your elbow. You can come throughout the forearm for getting carpal tunnel syndrome and doing stuff like that. But in general, when it comes down to like large body parts like low back, spine, neck, you can get into your occiput really well, and it is great for the stimulation in the occiput. You feel like really invigorated after. But like, as I was saying, large body parts like abdomen, there's no way I can get the one-shot therapy in on that general area. So we gotta get in with the WOLFE Non-Surgical techniques, and then we'll go in and pull those adhesions, fibroids, scar tissue buildup, and displace calcium apart. Do you want to show like the wrist and hand?
For sure, yeah, of course. Okay, so when I'm doing the wrist and the hand, I like to start on the palm, and it's really the same rules that are applied. So I'm gonna put some oil on the area, and then I'm gonna start right below my thumb pad into the wrist, because we have all those small little carpal bones just hanging out there, and it's just a great place for scar tissue crystallization to hide. So what I'm gonna do, apply some oil there. I'm gonna take the shot glass, I'm gonna place it in my hand, just like so. So I've got that bottom edge exposed. And I'm gonna do small movements. 1/2 inch, 1/4 inch. And right now, I'm pulling everything towards myself. And I can feel that cracking and popping of the scar tissue and crystallization right now. So I work that whole edge. And again, don't stay in one area. Keep moving, playing your angles. And I really want to get in the sides as well, especially if we have carpal tunnel. Really play all your angles, cover that whole area. Then I'm going to work into the actual palm itself.
Yeah, if they have carpal tunnel though, try to start, like definitely start with a clapping session on the forearm. And then get in like 5 to 6 inches above on the forearm a bit, because that crystallization has slowly rooted itself up to maybe even the elbow. So like, and that's the thing when I've dealt I've dealt with carpal tunnel so many times, and in general, it could not just be in the wrist. It could like stem from the shoulder or like whiplash from a car accident, and then that started pulling, causing a block here, and it's like, who really knows why you have that problem in that general area and why she got that and why he got that? All our bodies are different. There's going to be a weak link in everybody. So we just kind of have to play the investigation detective game and put the pieces together, and it all normally ends up kind of falling back to like the root cause of the problem was like the leaky gut or whatever, or there could have been a traumatic some like issue happen, or actually like accident that they went through. But in general, some, like I would say 80% of the time, their main problem is not the end all be all where I want to go in to help them look at, because it stemmed from something else. It was the way they kind of allow their thoughts to process in the morning and what they kind of start their day off like. It's the way they don't drink water until maybe in the afternoon, but had 4 coffees that morning, but still think that they were hydrated. It's maybe the way that they don't stretch at all, or they're too stagnant. It really just depends. So that's why we do promote the Perfect Day consultations, to kind of get like an overall map, have a great consultant that's going to be with you for life, that we can kind of create a program. And like, I want to get you to the point where you want to like, even if this isn't like your passion, your job, where you want to like consult your friends because you're like, I went through that exact same thing, or I went through something similar and this is how I got through it. So it's about creating like a perfect kind of lifestyle for you, and everybody's perfect is totally different, but we got to kind of figure that out together, I guess, and access what you truly desire so we can live to our full potential.
And it's about having the tools necessary, because it happens with me, happens this age where we creep back into those old habits, but it's like, no, 3, 2, 1, I'm going to snap out of this. That's my old self. Give yourself like a minute to rage on or freak out a bit, but no, you snap out of it and start loving yourself again. Because we all have those times where we just fall down, but we get back up. Fall down, get back up. That's how we're going to get through this. So,
sorry, I stole the carpal
yeah,
tunnel
that's
away from
okay.
you.
All right, so I worked right under the palm. I'm going to start working into the palm itself. And as I'm getting more into this meaty tissue, I'm going to apply a bit more pressure as I continue to work through that palm. After I've done that thoroughly, I'm going to work up into the base of the thumb. And we have these 2 little sesamoid bones right at the base. They're like little tic-tacs. So I want to work very thoroughly around those 2 little bones. Really open up that joint. Again, pulling towards myself, readjusting the shot glass, and now I'm pushing away. Getting into those little crevices and fossas. So I did the first joint. Now I can work my way up to the next. Pushing and pulling. So once I've done that, now I can begin to work through the metacarpals, coming through the hand. And it's the same thing, just like we did on the top of the foot, except we do have a bit more tissue. So you can apply a little bit more pressure.
And we're just going to take a quick pause there. So you were due for double knee surgery 12 years ago. What would the WOLFE non-surgical protocol be to get your knees to come back? It's good that you still have yours, so I'm happy to hear that. In all honesty, I want to know the area that you're in, but I would get you on a perfect day diet for sure, because I don't know the diet you're on right now, and like I would figure out what would be really great for you. I would get you clapping them 3 to 4 times a week for about 30 minutes a session, 40 minutes a session, 20 minutes in me would be best. And then you're going to be doing that 3 times a week. I would have you doing that for about 6 weeks. If you can do the one-shot therapy, as I was saying, around the general knee itself, and you will alleviate some of your pain, but with something this severe, I would recommend, depending on what area you're in, going to one of our WOLFE non-surgical practitioners. Or if you want to take a vacation, come down here to the actual, like where our Ixtapa treatment and training center is, down in Ixtapa, Mexico. I would recommend coming on down here. I would say I would want to spend about 3 weeks with you, 3 weeks to a month with you at most. Because if I did 5 sessions on each of your knees, because I would do them both at the same time, both within a session. If I did that 5 to 7 times, you would have the capability of going home and being like, I do have new knees, and I would continue having you work as you go home. If you had a partner or if you're married, definitely come down with them, because I would actually just do a personalized kind of treatment and training on you guys, how to work on like low back, knees, and I would show you how to take each other's knees apart so you can live freely in that general sense, so you don't have to go back down, because our bodies are not meant to live forever. If you think you can get through this crazy fun-filled adventure, as Dr. Wolfe says, without a scratch, you didn't live. You didn't live, you didn't enjoy. And yes, some of these things pain us down the road because we didn't address it when it was asking to be addressed. But also, you lived, you enjoyed, you had fun. So that is kind of like you earned it. in a way, but I don't earn going to a wheelchair or a walker. That, like, I don't want to earn that. I want to live until, like, I feel like passing on to another journey, but, like, I want to live where my body doesn't want to feel like it's breaking down on me. I know when I'm 80, I won't be able to backflip flat. And I don't think I'll really want to. Like, the older I get now, I'm like, I don't really care to do it all the time. But I definitely still do enjoy, because I want to stimulate my body like that. But like when I'm 80, I definitely want to be able to do 20 burpees or like 50 push-ups, because I constantly made my body stimulated. I focused on keeping me younger. But I know I'm not going to be alive forever. So we got to expect, like, this is going to go wrong, that's going to start. So by doing that on your knees, that is your weak link in your body. So down the road, 10, 6 years, you're going to be like, ooh, my knees are acting up again. Or even like 8 months later, you're like, oh, I tweaked something doing a hike or doing that. And it's like, oh, my knee's acting up again. That's why we do the personalized treatment and training, to have hubby come in 10 minutes later and just get into that knee, alleviate some of that stress so it doesn't bind in scar tissue and crystallization and calcification. So we keep our joints healthy, lubricated, young. So let's go into that question and then we'll get back to the hand. I had sciatic nerve pain and a Thai teacher popped a knot in my back and the pain went straight down my back bum, down my leg, into the heel of the foot. It was amazing. It felt like I had stood on a nail, and he said, go home, put pressure on that point and massage the point when you get home. And you were cured of sciatic nerve in one session. Absolutely amazing. Guys, I looked at my reflexology chart and the pain was exactly where the sciatic nerve is. Totally. And just touching on that. So down your back, it usually actually starts, people say they feel the pain down in their like lower butt cheek, come down their leg, but it actually a lot of times started in the low back. And then it stems down to that ischial tuberosity right under the butt cheek. You have this port, and then that sciatic, this is the sciatic nerve, and then like my ischial tuberosity is kind of here, and then the sciatic nerve will build up crystallization all around like the hole that the sciatic nerve comes through. And so it isn't able to retract and kind of like move freely in that general area. So when I go to bend or move, it's like a searing pain down to my heel. Why is that? Because there's too much crystallization around the ischial tuberosity in general and coming back down the hamstring a little bit. I would say normally with like chronic sciatica, it's like 2 to 3 treatments, and that would be like I would be surprised. After the first treatment, it normally 80% it goes away, and then it comes back a bit, and they're like, oh, I kind of feel it over the next couple days. But yeah, sciatica can really be a debilitator for sure, so I'm glad that worked out for you.
Lisa, this works. My cousin had TMJ pain for 10 years. She went to Hardley Street dentist, wasted so much money, etc., with different healers, and it was a reflexologist that cured her. I love this, so interesting.
Good.
Thank you for sharing.
Yes, you're planning to come to Ixtapa in the fall for my knees, severe bunions, and my neck, basically the 100,000-mile makeover. You know what, darling? We are going to get you exactly where you want to be. And the thing is, where you want to be, like right now in your mind, is only right now. As soon as we start showing you that like your body can feel so much better, you're going to be like, that's not even close to my goal anymore. And that's the thing. Strive for perfection, but know it's not achievable. You're already perfect, but do better, please. Like, simple, isn't it? I'm just kidding. It's a task, and I struggle at it daily, but I will work at it daily for you guys, and not for you guys, for me, so I can be a better me for you. It's like sounds super complex, but if we put things into kind of like a simpler structure, it's like self-love is kind of where it's at, because I am truly giving up my power by thinking I'm loved by other people, and I go home and I cry at night. That makes no sense. I've not been fulfilled. But if I go home with a smile on my face every night knowing I did what I did, even if you feel like you offended somebody, even if you feel like you kind of hurt somebody, were you being authentic with yourself? Were you coming from a place of love? Were you coming from a place of respect? Then it's like, then you did no harm. You know what? Maybe you woke something up in that person. Maybe you touched on a subject that was sensitive for them. It does not mean you're a bad person. That means the person you were talking to has finally started to open their eyes to something that you were saying.
And also, it's comparing yourself to others too. Like initially, when I started working here, I was always comparing myself to Sage, and I'm like, I wasn't good enough.
You're never gonna be me. He's not even close to going to be as good as me, because he better not be as good as Sage, because I'm Sage. Can't take that away from me. He gets to take what he wants. I'm never going to be as close to as cool as Jason for Jason. But that's for him. And I'm like, I won't be able to touch the aspects that people love about him, because that is him. There's billions of people on this planet, and we are all very similar. We're all humans, but there's not one similarity in one person that I can put together that I would be like, you're the exact same person. Twins aren't the same people. They have different fingerprints, for Christ's sakes. It's so true.
Yeah.
Like, if you look at their actual fingerprints, there's nothing that actually relates them to the same person. And that personality is going to be so different from the personality beside you. He can never compare himself to me, and the day he does is the day he is a crappy practitioner. The day he isn't authentic with trying to be a good practitioner, it's where he's not being good to him, because it's a constant comparison to something he will never be. I
can only compare myself to how I was yesterday and grow from that. If I'm going to compare myself to Sage, I'm never going to get better. And I would put myself down all the time because I wasn't as good as him, or I wasn't able to speak as clearly as he does when we're doing the teachings. And it's not about that. What did I do better than yesterday? I'm going to keep growing on that, because I know I'm already great, but I know I can do better. So I'm going to keep striving for that. And that's how we're going to continue to grow.
And that's why we love now coming on with you guys, because it's this is super new to me too. So I fumble my words. I kind of get caught up. But you think I'm bagging on myself at the end of this? Yeah, right. I had the confidence to come up. I had the confidence to try to train you guys on something new. And you know what? I really hope that I touched at least one of you. And if not, one day I will. But in general, Lisa, there's nothing to be embarrassed of ever. I am so glad you shared that with us, because it's a beautiful story. So thank you so much. There's no embarrassment. I'm sweating up here, man. I'm embarrassed. No, we gotta make a joke at the moment, but take everything seriously. But take it seriously with grace and ease, and with laughter and joy. If we're gonna lose that inner child, life's not fun anymore. So, did you finish the hand?
I was getting into the fingers. So, I was coming through the metacarpals. Now what I'm gonna do is I really wanna focus on these first joints here. So really spend your time carving out that joint, playing all your angles, pulling towards myself, pushing, and then now I'm going to work up the finger, and I can scale along the bone ledge, but I really want to focus on these joints here. I'll bring up a story. I don't know if you'll be able to see it through the camera, but back when I was in grade 12, I was playing football, and it was a long pass was coming, and I went to go swat the ball down, and the ball came directly into my pinky finger, and it dislocated both the joints. So my coach came, and he pulled, and he popped the joint back into place, but I didn't realize that this one was also popped out. So I'm like, why isn't it healing? So we tried taking a stick and taping it around there to see if it would straighten out. It wasn't straightening out, and I was bending my finger like this for about 2 months. I ended up having a pin placed into my finger to straighten it out. Now you can see that there is a ball of calcification. A
little bit of displaced calcium right on the knuckle itself. Yeah.
So what I do, especially when it's hurting, well, first I'll take the clapper and I'll chip at it using the side of it, like I'm sculpting out a marble, and I'll chip at it, get some circulation in there. But I will take the shot glass, and it's the same thing for each joint. I'm going to really focus along that ledge, playing around that formation. And as I'm going, I can feel it starting to open. I want to work with that. I found the crack in the knot. I want to keep working through that, bringing it down. But I'm going to monitor how much time I'm working on that, because honestly, there is a good amount of calcification there, so I can get carried away. So it's like the guy that hasn't been to the gym in 5 years, gets himself some new equipment, has the craziest workout of his life, and then he's just blown out. Yeah, doesn't want to do it again.
Right,
so I could do that on myself, get a rash, and be like, this doesn't work. I injured myself. No, let's take it easy, one step out of a time.
And the amount of people that a new year, I go to the gym, and they go so hard. so hard the first like week. There's no time for their body to recover. They hate it. They're like, yeah, the first week, because it's a new year, new me, I'm going to go transform myself. And by the end of the week, they're like, yeah, I'm feeling good. But by the end of the week, when the weekend comes and it's time to relax and go out and drink, they do that, but their body feels so depleted that, like, on a subconscious level, they know, do not go to the gym again. You felt like garbage every night. There was too much lactic acid in the muscle tissue. I was exhausted. Nobody goes in with ease anymore, and that's all we try to say is just like, go in with grace, be an observer, dip your toes in the water, and if you really like it, you can kind of jump in a bit. But like, we gotta kind of learn to swim before I go take on the massive waves in the ocean. Learn the pool first.
So Lisa has a question.
What's good for wisdom teeth pain? Please, my son has that.
On his fingers, looks like arthritis.
Okay, so he should be clapping his hands in general, and he should be doing the bottle work like Jason just said, like on each individual joint. And then if you want to get the DMSO gel, put little bit goes a long way because it can dehydrate the skin, irritate it after a bit, so he just needs to monitor that. But you're going to take little Band-Aids and like a little glob of the DMSO gel and put it on the joints that you feel look more swollen. For wisdom tooth pain, just make sure, and in all honesty, like I do like tell people, like, yeah, you want to keep your wisdom teeth if you can. Go get them checked at the dentist to make sure they're coming in properly. Because, like, I tried for years to keep mine in. And boy, did I learn. So I had these two in the top coming in sideways. And they already came all the way in. But, like, they were just kind of breaking through. And then I had one down here that came through, and then one that didn't. And I was like, you know what, I'll live. Like, they're great. They're here. They already came in. They're not bothering me. And over time, I was starting to notice, like, my teeth here were starting to shift a little bit. And then I was doing a training out in Baltimore, and I wake up 2:30 in the morning, just the worst abscess under my gum on the tooth. Because if they don't break through the surface of the skin, you're constantly getting bacteria in that general area. It's smarter to get them out. So, and especially if he is like in his like later teens, get him out now so like they don't even progress to get worse as he gets older. So I had to go in for an emergency dental removal on that tooth. And then I was like, oh, I don't need the other ones. I'm good. I had the bad one taken out. I get back to Kelowna, and they're like, whoa, you're getting a really big abscess on this tooth because it was getting sore. And I was like, man, like, can I not catch a break? So I go and get this one removed. The top two, like I said, kind of came in, but they came in sideways. So they were pushing on. So I go to the dentist, and I go to the dentist here now that I moved to Mexico because I was like, I'm not going to get the other two removed because it's $1,000 a tooth where I was at home. And I was like, I'm going to go to Mexico when I live there, and I'll get it done there. So I'm here, and they're like, see how your teeth are shifting? You could start to maybe need braces if you want to keep those wisdom teeth in. And I'm like, man, these wisdom teeth have just been a pain. So I actually got them removed here. And over the past, like, I got them removed, I think, 2 months ago. I've noticed my teeth have actually kind of straightened themselves out a bit. And there is just a slight gap right in the front, too. Not a gap, just like an indentation. But they were getting a lot worse. So before things get worse, get them removed. At least get them checked out. If they come in properly and they're straight in, great. He's just getting wisdom tooth pain. I would recommend maybe putting like peppermint essential oil or like Pain Away or Healthy Mouth, like any of those essential oils that we kind of have to kind of numb out the general area. You can put immunity is going to be amazing for it. And like, if he's really tough and feeling up for it, and maybe there's an infection going on, put 1 to 2 drops of like our super strength oregano in water and gargle with that water. He can drink it down if he wants to. It's just going to help clean him out. But gargle with that water twice a day. Really warm saltwater gargles. Saltwater gargles are like, people don't rave about them as much as they should. It's great. Like, but make sure you're doing like real sea salt or Himalayan salt, no table salt. And you can do oil pulling too, but I would recommend oil pulling like once every week, twice every week, not too excessive, because then you can weaken the actual gum like integrity around the teeth themselves. So don't do it excessively, but like oil pulling once a week. And if you're going to do oil pulling, I recommend doing it with C60 coconut oil, because then you're kind of getting any free radicals in the mouth out of there. So that's kind of where I would be at for that general.
And just to make a comment about like just taking things to the next level and being a bit too aggressive, it's like we're back in Kelowna. We're wondering why our gums are bleeding all the time. We're like, I don't understand what's happening. And then it's like you're using the water flosser on a high level all the time.
All the time.
You're irritating your gums constantly. So yes, it's helpful, but like we don't want to take things to the extreme. We want to be considerate and making sure that we're not irritating the gums. So just another tip, don't use the water flosser too high.
Yeah. Sorry, he was just saying, yeah, on the joint, what's the DMSO gel? Thank you. And no, they're coming out. No, they're coming out. Oh, my son's 20, severely disabled. He doesn't cope with pain. Yeah, his did grow in at an angle. Where do you massage on your hands and feet for the pain? That's great advice. A lot of times I would actually do some like light massaging, and Jason will go over the shot glass therapy just like around the TMJ, and it's in a loving way and along the jawline to alleviate the tension in that area. And then I would be taking like Muscle Restore Pain Away essential oil and rubbing it around here on his face, and that would just kind of help relax him. You could put peppermint on the backside of his occiput for stimulation, relaxation, just as the pain, like after he goes through the extraction. That'll really help, for sure.
Awesome.
There was one other thing I thought I read. No, I think we're good. So do you want to do a little bit on the face?
Of course. Okay, so to focus on the TMJ. So if you want to find out where your TMJ is, you can just clench, and it's that muscle.
You'll feel it contract.
Yeah, exactly. And again, like we work with TMJ all the time. What's making you frustrated? What are you not vocalizing? What are you keeping internally?
Well, the TMJ, as we call it, it's the FU point of the body. It's everything I've said because you piss me off so much, and I'm just so angry. And it's everything I've had said to me, and it's like, am I really that bad? And going into my head, a lot of our emotions get stored within this general area. So we have, one of our video guys is coming in here to distract me. So we have our TMJ, and like that is, bless him, he's non-virgil. Totally, bless his heart. He has TMJ pain too as well. Is there any pressure points in the feet and hands though? Lol, thank you. You can go over with the non-surgical, and I'll just check that out.
Okay. All right. So where I'm gonna start is, do you feel this cheekbone, the zygomatic bone? I do want to start right under that bone, and I'm gonna pull the skin taut just like so, because we do have a bit more looser skin up on the face. And you can use coconut oil, but with some people like myself, the coconut oil will clog my pores. Unless you're using like MCT coconut oil with the C60, that is fantastic. Moringa oil works great. But anyways, I put a little bit of oil, keep the skin taut, and I want to be working that TMJ. And I'm coming through the striations of the muscle. I'm working vertically, I'm coming horizontally, I'm pulling all angles and directions, working those tight bands of that muscle. As I'm coming through the muscle, I do want to come to the ledge, right on the mandible, and I'm playing off of that ledge. And like even for myself too, I can feel it is sensitive, and I can feel a knot right there. So I'm gonna play my angles, and feel that tissue loosen up. So I work that whole ledge, and then I can continue down the jaw itself. And as I'm working that jaw, I want to come into the bone. I can scale on top, and I can come right underneath. And I can feel bands and strands of scar tissue as I'm going down.
And I'll just say, I brought my phone out because I am not a reflexologist. And so I just need to kind of check something out to see where exactly like you'd want to go for him for his relaxation more so. I would be stimulating all his toes, so like really grabbing and pinching the toes. And when you pinch the toes, it's good apparently to pulsate 3 times on each individual toe. So do that for all his toes. I would do it on both feet, and then you can also come into the palms of the foot too. That would be the general area for like the face, TMJ, sinus. So that's what I found out.
Awesome.
Yeah.
Thank you. Okay, so I finished the actual TMJ. I came through the jaw itself.
Oh.
You guys can't hear me.
So you go along and I'll talk. So
Okay.
he finished the TMJ and now he's working out along the jawline itself. And so he's coming under his jawline, on it, and right off of it. Don't come onto the teeth because like you'll actually like damage your gums a bit and you'll be like, oh, I taste blood a little bit. So don't go too crazy. But you're working, and use that other hand like he's using right now, kind of as like a guide hand. He's kind of pinching off so he doesn't go in crazy directions and just pop up onto the teeth. You're golden now.
Awesome. Thank you.
Sinuses.
Sinuses. Okay, so where I started for the TMJ.
And they are intense though, guys. Like
It
when
is.
you're working the sinuses and the ocular bones, like it doesn't feel good. Like I'm gonna state it from like, it's hard to be relaxing when I'm wanting to clean out my sinuses. Yes, I can go lightly and lovingly in doing it, but that's gonna take me all in all probably like 3 hours over 4 months going really lightly, hardly touching the surface. But you will, like some people may get a little bit of black eyes, so just be wary of that. So don't go have like graduation photos or stuff like that right after you clean out your sinuses because you might be a little swollen.
And a few tips before you even start doing the shot glass on the sinuses. If you're eating dairy, cheese, inflammatory foods, you're gonna have more of a buildup along the sinuses. So if you are noticing you're having some sinus issues, congestion, cut those foods out.
Yeah.
Cut the dairy out. Start doing hot water, nebulizing the iodine, getting on the daily cleansing tea, getting those bowels moving to take the burden off the sinuses. Because we will dump toxicity in the sinuses first. So that's like the alert system. You got an overload of toxicity, it's going to send an alert to the sinuses. But like anything, we keep numbing out pain, it's going to go somewhere else. So yeah, just few tips on diet. Next, so to do the actual shot glass, so when I did the TNJ, I started right under the zygomatic bone. Now I want to isolate that zygomatic bone itself, and I'm like sculpting it out. So I can start right above.
You're gonna feel like little pebbles along your cheekbones, like they're like little rocks. I definitely did MMA when I was younger, so I got pretty big rocks. Like my thumbs are even popping over chunks right now, but you will feel like little chunks. And people are like, what is like a non-surgical facelift? Like we are literally re-sculpting these facial bones so people can look like 7-10 years younger after a non-surgical facelift. Yes, they will be swollen afterwards for a couple days. Yes, they may get some bruising, but we will take years off the face because we're re-sculpting the bones. From me going like this for so long, I'm going, like if I do this for weeks on end and I just had my forehead lines like this, I would let go and you would see a lot deeper creases because from holding it in contraction, you're actually building up a little bit of crystalline buildup, holding that skin in that kind of line of like a suture kind of look.
And also that tension that's going to be released, all those years of being frustrated or having that concerning frown is going to be released. Like I feel years later after we've done like a non-surgical treatment, it's like, yeah, because you've been holding those emotions in your face for so long.
And that's the thing, like, we're not always going to be perfect. Don't bag on yourself about it. Like, I would care to get a little bit more non-surgical work than I do. I would care at times, like I get to the gym about 3 to 4 times a week. I would prefer to do it 5 to 6. I don't always have time, but am I like hating on myself for not doing it? Am I like, oh, you're a shitty person? No, I still love who I am. I still know I can be better every day. I know I'm gonna fall. Pick yourself back up. We're here for you. You should be here for you first. But if not, the times where I do fall, I let Jason know, like, I'm not in a good mood today, like, either stay away from me or, like, let's have a conversation about, like, why I'm kind of in this funk, because we all get in funks. And you have to allow yourself time to process things. You have to allow yourself time to grieve. But am I going to be in the point of like self-pity, self-doubt, lack of self-worth? No. I know I can come out of this. Set yourself a timer. I'm going to choose to be mad at this for 3 minutes. No, I'm not there yet. I'm going to choose an hour. I'm not there yet. I need 24 hours of misery. Oh, well, that's where you're at. Next time you get miserable, you better put 19 hours on that clock. I better see something small of like small, loving, gentle baby steps is how you're going to imprint on yourself. You jump too quick, you're going to forget.
All right, so what I'm going to do again, applying the oil, I'm going to pull the skin taut, and I'm working right above that zygomatic bone to begin. And it's small movements, especially in the face. I'm not dragging it out. Small movements. I'm not rubbing. I'm bringing everything into that bone. And I'm going to come under the eye, and I'm following the bone to get into the sinuses itself. So I can take my hand, I can pull it out of the way, my nose out of the way, and I'm getting right into the sinuses, coming up along,
and
up into the nose.
Feel your sinuses at home. Touch on either side. How thick are you on one side? And like go into the mirror and look. How far does the arch come out? Does the arch come out and is it really thick all the way out here? Clearly your sinuses have been blocked for a long time. Do you have a very very narrow nasal cavity area? Then you know you actually might have a pretty light, non-inflammatory diet. And so, you know what? Give yourself some credit. But if I feel like, oh, it's just thick and tough in here, but it's not like the cartilage on my nose, it's like, why is it so tough out here? It's like, I know I've had a little bit too much pizza lately.
So I'm going to continue working along that bone, pulling away from my nose, adjusting the shot glass, so I'm bringing everything into the sinuses itself, just playing on my angles, and then I can work back to my starting point. This time I'm pulling everything under the zygomatic bone, under that cheekbone, working out towards the ear. And the skin is sensitive on the face, so just make sure you're monitoring how long you're staying into one spot.
Little Kaza just asked, what instrument are we using on our skin? Can this be purchased in the UK? So this is just a shot glass. Yeah, we have, I hope so. I think so. You better be able to get them there. So we can either use essential oil bottles, as I was saying, something with a rounder edge. We make these shot glasses, but you can find shot glasses with a round edge, glass or acrylic, but nothing that's too thin that has like an abrasion on like the edge, because it'll break the skin a little, like it'll break the skin fairly easy if it's like very narrow. So our edges on these shot glasses are just rounded, and we're using those rounded edges to play different angles, working in and around our joints, pulling apart the scar tissue crystallization and displaced calcium. So,
another thing too is facial scars too. Like I had a trauma to my head, and I have a thickening of scar tissue that goes probably like an inch down into the forehead and then an inch into the hairline. I'm going to isolate that, and I'm just coming through the striations, and I can feel the thickening of scar tissue. So I'll continue to work up into the hairline as far as I can feel the scar is going, but I'm also going to work around the scar as well, because it would have created roots coming out. So I want to go ahead and make sure that I cut those off as well in a loving way. So I worked all through the scar, I worked around it. I can also work on my frown lines as well, because that's what wrinkles is going to be. It's going to be deep scar tissue and emotion. So pulling the skin taut, and I can work along my wrinkles as well. I can do the same thing along the lateral edges of my eyes, along those crow's feet. And it's always the same thing. having a good placement of the shot glass, using that edge, and I'm pulling or I'm pushing.
And you want to do both.
Yeah.
You want to do both general, like I'm doing both directions, not always, because then that's scrubbing, but I'm doing both directions within the session that I'm doing. So if I'm doing my wrist or my face, I'm pushing one way and I'm pulling the other.
Like for example, I'm right up on the outside of my eye and I'm pulling and I'm honestly not feeling much. I changed the direction and now I'm pushing. And it's like I can feel a mass right along my temple. And it's like if I only pulled one way, I wouldn't have felt that. So that's just the importance of playing all your directions and all your angles.
Perfect. So guys, like this is the WOLFE Non-Surgical training at the Detox, and so we are going to be kind of coming on and just kind of going over different kind of techniques that we do on different parts of the bodies, things that we've kind of come up against that have made us like, oh, like that's how I would deal with this certain ailment, or that's what I would do with that problem that you're having. So we're going to be coming on every Monday at 3 p.m. CST to do these shows. Me and Jason will be doing another show hopefully soon. It'll be kind of created once kind of things get a little bit more organized here. We want to be doing a Braveheart generation. So that's going to be for anybody of ages from toddlers to hopefully 90-year-olds. And it's going to people who like want to wake up a little bit more, want more power within themselves, and instead of like feeling like they're letting themselves go and not allowing for them to have their own amount of self-worth and self-love where they feel like they're actually being like judged all the time, or I feel like I'm not worth it. Like we want to show people that like they do have that self-empowerment within them. They just haven't learned how to access it yet. So we're going to be creating a Braveheart generation real soon here, so please stay tuned for that. I really, really appreciate everybody kind of coming on and just kind of tuning in with us to learn a little bit of the one-shot therapy.
And we love your questions. Please keep getting your questions coming in.
The less the questions happen, the shorter the videos will be. So we want to be able to stay on here for like a good amount of time with you guys. I don't know.
There is one more question, Linda. What is the correct way to use a dry skin brush on your face, neck, etc.? We do have a dry skin brush video in the do-it-yourself guide in the library.
And go check out that video. Like they'll show you how to do the whole body, but they go over how to work on the face and really dry skin brush the face, and then what kind of scrubs you can do afterwards, and like what we would apply afterwards in general.
Just a few tips. When you're dry skin brushing, you want the skin to look pink after.
Yeah.
You don't want to go past that. And especially the face is more sensitive skin.
So just do light skin brushing at the beginning, just to kind of get off all the dead skin, depending on like, because we have some people who do it and they have very, very dry skin in general. So they have to go very light at the beginning because we don't want to rip or tear anything because that'll cause scarring. But we just want to replenish by taking off all that dead skin and just having that skin brush. You're kind of just lightly, like when I'm on my legs, I'm vigorously scrubbing. On my face, I'm like kind of holding the weight of the brush and just kind of working around nicely before I would apply like the Silver Bullet gel or the Beyond Beauty cream.
And dry skin brushing throughout the whole body. You always want to be going the direction towards your heart.
The lymph. So we just want to touch on, like, thank you guys for joining. If anybody is interested in like taking our courses, becoming an actual practitioner for themselves or their family, or they kind of want to take this and create a business out of it, we have upcoming courses here in Ixtapa at our Healing and Training Center for the WOLFE Non-Surgical. That'll be from May 11th to May 22nd. We have a pain-free pelvis course as well, and that'll be from May 25th to the 27th. The whole new World Practitioner certification is in May and June, so that's from May 29th to June 6th. And the WOLFE Non-Surgical will be from June 9th to June 20th, and that'll just be the WOLFE Non-Surgical itself. And then we have another new World Practitioner certification course in June and July. So the Whole Life Coach is from June 27th to July 5th. The WOLFE Non-Surgical is from July 8th to July 19th. And then I'm going to be in Dallas doing a WOLFE Non-Surgical training as well. So that one is going to be in Dallas, Texas, come on out if you're around that area and you want to learn how to become an awesome body work technician with WOLFE Non-Surgical Therapy. And that'll be from July 23rd to August 5th. And then I'll also be in Toronto. So for the Whole Life Coach in Toronto, that'll be with Dr. Wolf, and that'll be from July 28th to August 5th. And then my WOLFE Non-Surgical training will be from August 8th to August 21st in Toronto itself. If you're coming out here, you're going to need a letter to kind of travel out. So to receive a travel letter for attending treatments and trainings in Ixtapa, just sign up for the Perfect Day consultation, and we need you to take a consultation before you come out so we can create a perfect day to get you on a good program before you come out here, because the course is pretty darn intense,
You
guys.
want to be prepared before you come. We want to bring down that inflammation as much as possible. We want to get you in a good shape because it is a hands-on course.
Totally hands-on. The Whole Life Coach is going to change you emotionally, mentally, and like a little bit spiritually. And it is draining of the mind. And then when I get my hands on you, it is very physically and emotionally draining, because we are constantly for 6 hours a day working on the body and getting worked on. So like I was saying though, to receive a travel letter, sign up for the Perfect Day consultation and select the travel letter add-on on the side. And it's just an additional $5, but the client will receive a travel letter at the end of their consultation via email, and that'll kind of get you out here. If you all...
Joanne, she had a question. I want to register for programs in the fall. Will there be programs then? Yes, we will. We just don't have the dates exactly at this moment. So as soon as we have those available, we'll get those out to you.
So we're technically, like how the company kind of goes though, is we normally do 3 on, 1 off, just to kind of give us a break, because we need a break, like in all honesty. So we do 3 trainings back to back. So it'll be like July, August, September. We take October off. Then it'll be November to December, January. Normally we take like towards the end of December and the beginning of January off. That'll usually be a month. So I'm thinking October, November, and then like mid-December we would have one as well. Just right before Christmas it would probably be finishing up. So it would be like end of September would be the next session of 3. But just please go to itioh.com to just check up and keep updated on the next coming courses for the fall, for next year, because like we have people that do book like, oh, I want to come to the one next January, and it's like you'll see the dates pop up, but we'll always have them come up a few months prior so we can kind of get you on the right track.
If you wish to listen to our audio versions in our shows, you can find them on iTunes, Spotify, and SoundCloud.
And for all of our shows that are like a little too hot for Facebook, and that just means like I can't go up on Facebook, you can find them on different platforms, like on Telegram at t.me/the Doc of Detox. We're on Rumble at Doc of Detox, Bitchute at Doc of Detox, Odyssey at Doc of Detox, and Brighton at Doc of Detox. So it's always just us, depending on what you're trying to watch us on. So other than that, guys, we just hope you have the most happiest, healthiest day of your life until tomorrow, of course.
Thank you so much for
And
watching.
thank you
We
for
appreciate
joining and coming
you.
on.
Have a beautiful rest of your day.
Bye for now.
You know, it's not good enough to have the most powerful courses, treatments, and training. We want to deliver to you the adventure of a lifetime that's going to last a lifetime. And I'm going to take you on a little adventure right now and show you what we are going to deliver. What are we going to deliver? We are going to deliver the authentic you, the real you, the genius inside. How would you like to become not just the master of your mind, but the master of your body, the master of your life? You know what? The most important world is your world, and we're about to show you how to create it.
Found Dr. Wolfe and all his positivity and trying to reshape our way of thinking and help me be a better person, a better mom, better wife. I'm glad I found him in person in Ixtapa, Mexico.
Never limit yourself to beautiful, because that's what you are. Take a look at this beautiful place. We all deserve beauty in our life. You need to create a new program that is unlimited when it comes to things that are beautiful, things that make you happy, things that make you shine, things that make you feel excited. Let's get excited.
This guy's got something really interesting to say and he's sharing it really openly and we're just really not caring what other people think, and I just thought that was really empowering.
What I've learned in my life is this: to be the change you wish to be the change you wish to see, Braveheart, you have to understand you take life one step at a time.
Dr. Wolfe, as many people will have seen, is very direct and straight and will take you to the edge of the cliff, as he says, and then pull you back just in time.
Never lose your focus. Never lose your dream, because you are the dream maker. It's called image, but guess what? It's your imagination. The image that you hold creates the thought that you live with. That thought creates an emotion that creates a frequency, and we know that the invisible creates the physical. I mean, that's quite obvious. So be the power that you seek, and understand something, that all your thoughts matter. And guess what? Unless you're willing to take a look at those thoughts and retrain your brain, change your personality, you'll never change your reality, and your reality could become infinite.
He's a wealth of information, and I love it.
You were created by your creator to create. So let's create something amazing together.
I found Dr. Wolfe and I went, wow, here's a truth speaker. And he spoke to my soul and he spoke truth.
So tell me what you think of the destination that I came up with my imagination to hold the whole life coach certification for you. Understand something. It's all about beauty. It's all about adventure. It's all about stimulating the mind, okay? And understanding that your mind is unlimited. And that is what the whole life coach certification is all about. In the whole life coach certification, we are going to go deeper. We have people coming to us, professionals coming to us, from doctors to nurses to accountants to oil riggers to mothers that want to expand their life. And when they come here, they go, I need to learn to help my family, or I want to improve my business. But guess what? We get into their business. When they leave, they become the change that they wish to see, that they wish to be. They become the gift to the world, because when you can stay in the present, and you can't do that until you have unconditional love and care for yourself. And I'll tell you something right now. I have hardly even found 1 out of 1,000 practitioners, or even so-called whole life coaches, that can hold the present moment and own it and then give it as a gift. And this is what I'm going to give to you. And when you come here, this is where you're going to come into this room when you need to find alignment, you need to find balance, and you need to get back into your lion heart breath, because we're going to go deep into your heart and we're going to become the spark that you seek.
And actually what I really love about Dr. Wolfe's teachings is that unconditional love is literally it. And then you're like, how can it be that easy? That's just silly. So, but it's really not.
Come play, come stay, come train with us today. Understand something. I know we have fear, but understand, that's just false evidence appearing real. I get it. Stick your toe in, feel the water, but then I want you to dive right in because
How I found my brave heart was through Daryl. He really teaches you to go within and go in through your heart and not your mind, because your heart's a lot more connected to so much more than your mind. Your mind is just so conditioned and your heart is just so open and beautiful.
you're the answer that you've been looking for. Let me teach you how to fly. What does that mean? First, love yourself, brave heart. Let's take life in and win.
I had just lost my husband a couple of years ago. With his passing, he gave me the greatest gift to love myself. But Dr. Wolfe gave me the greatest gift in understanding that.
I had a dream 3 years ago that I would live in Mexico and I would have this training center, this teaching center, this treatment center that would touch the world. Your dreams are never too big. And when they start to create a little bit of anxiety, turn them into excitement. And get excited because this is your life.
He's the first doctor that I have encountered that has truly given me the truth, and not just half truths, but the full truth. So it's been revolutionary for me in my healing process.
And this, my friend, when you take on the dream of all dreams and you realize that if you stay connected to your breath, that you can have it all. Do not let anybody take your breath away. Do not let anybody steal your dream, okay? Listen, God gave you imagination. This is your sandbox of life. Take your life back. Right now, we are teaching courses to people that have come from all over the world, and the government is saying you can't travel, you can't breathe, you can't have this, you can't come together. Yes, we will. And we will do it with unconditional love for each other. And we will learn to grow. We will not judge each other. We'll observe and see where we can support each other. But at the same time, we will hold the Braveheart line, because this is the only way that we can grow. So find your roar, because you're so much more. And learn this. You are the unconditional love that you've been looking for. You are the dream maker. I can't wait to see you. We want to become that small piece of the puzzle that brings your dream together. Thank you.